Hello everyone. Today we will study the topic of primary effects of CNS trauma. Under this topic, we will first have a look at scalp injuries. Basically, the scalp consists of following layers: the skin, the connective tissue, galea aponeurotica, then the loose areolar connective tissue, the periosteum, and then the bone. The mnemonic itself is scalp. Now, the scalp injuries, it includes lacerations, cephalhematomas, and subgaleal hemorrhage. We will take a detailed look at them. Lacerations, it is basically the focal discontinuity and can be associated with a soft tissue swelling or a subcutaneous tear. In this image, we can see that there is the focal discontinuity in the layer of scalp. Often, hyperdense foreign bodies should be looked for within the laceration, as it is seen in this image. Also, the subgaleal air can be noticed. Now, we will study cephalhematoma versus subgaleal hematoma. Basically, cephalhematomas are subperiosteal collection. That is the collection between the periosteal layer and the outer layer of calvaria. So they are limited by the sutures, henceforth are mostly unilateral. Sometimes due to chronic cephalhematomas, the outer layer of periosteum, it undergoes dystrophic calcification leading to the firm palpable swelling. Now we will have a look at the theory. Cephalhematomas, they are subperiosteal blood collection. That is, they lie between the potential space between the outer surface of the calvaria and the pericranium. They are extracranial equivalent of intracranial epidural hematoma. They do not cross the suture line, therefore are typically unilateral. And the complications from cephalhematomas are rare and they mostly resolve spontaneously. And we have also studied that occasionally the elevated periosteum at the periphery of the chronic cephalhematoma can undergo dystrophic calcification, creating a firm palpable mass. Now let's take a look at subgaleal hematoma. Subgaleal hematoma are basically subaponeurotic collection, that is collection of blood below the galea aponeurotica. Therefore, it can easily cross the midline and spread over the entire calvaria. So basically, subgaleal hemorrhages is when the blood collects under the aponeurosis, the galea. They are anatomically not limited by the sutures. Therefore, they are bilateral lesions which will spread diffusely around the entire calvaria and they cause significant blood loss unlike cephalhematomas. In this image, it is clearly depicted about the cephalhematoma and the subgaleal hemorrhage. The cephalhematomas, they usually occur after an instrumental delivery. Now in this CT images, we see two collections. These two collections does not seem to cross the midline and appear to be limited by the sutures. On the coronal image, we can see that how the elevated periosteum is separating the two collections. And in this image, we can see the same collection does not seem to cross the coronal suture. So, it becomes the cephalhematoma. This is subgaleal hematoma. Subgaleal hematoma is seen spreading diffusely around the entire calvaria, crossing the suture line. So, this was a small topic on the scalp injuries. In next lecture, we will study about the skull fractures. Thank you.